Hello and welcome to the City of Boston's 2019 Annual Homeless Census Training for non-HMIS providers. My name is Jennifer Flynn. I'm the HMIS Administrator for the City of Boston. Just want to tell you a little quick information about what the homeless census is and then go into some of the data that we collect around your programs and the clients in your programs. So the annual homeless census is a requirement of the federal government, and it is the one night that the city truly does get a full and accurate picture of the homeless population in the city. All shelters report in their numbers to us, whether they be HMIS providers or not, like you guys are non-HMIS providers, and we appreciate this. Also, it is a companion street count happens the same night where 45 teams actually go out and do a full canvass of the entire city for clients who are sleeping on the street and other places not meant for human habitation. And they do their best to try and get them to come into shelter and get on a housing path, but at least get us some information about who and how many folks are out there on the night of the count. So we're going to do this training a little differently. I am going to switch between a couple of different screens for you guys, but we do just want to let you know that there is a new data collection.
City of Boston Department of Neighborhood Development.
Kind of
this is
the
the
demographic information
2019
collecting about the clients. City of Boston leadership has decided to require the collection of community of origin for all clients entering into programs, whether it be shelter, transitional housing, rapid rehousing, or permanent housing. This is not an eligibility requirement. This is truly just a data collection for information purposes. In the past, one of the elements that was collected as part of the HMIS requirements was zip code of last permanent address. This data element was taken out of the federal requirements just over a year ago, and because Boston is, as a large urban metro area, is serving not only folks from all of Massachusetts, but New England, we really need to try and get some information around where these housing crises really are starting to pop up in other parts of our city and region, and work with our city and neighboring cities and towns in order to make sure that the appropriate services at the appropriate levels that they need are in those communities. So again, very quick, we do have a one-page document that will be available to you as well that you can use to collect this information. Sorry, you guys don't need to see this. It is on your client data collection form. So we'll go through that in a little bit, but I did want to just let you know that that is happening. So the night of the count for non-HMIS providers, we actually ask for two different pieces of information to come from you guys. We ask for what is we call it either a confirmation count or a quick count. And we ask for this to come in from you guys by Friday, February 1st, just so we can start getting a more overall understanding of what the numbers were that night. We will have this information fairly quickly from the HMIS providers because we get that on a nightly basis, but non-HMIS providers, we have to wait a little bit longer for you guys. So this first questionnaire is really just about how many people were there that night, very brief total aggregate numbers. So if, folks have been around for a while, you'll remember Jim Green says, save your bed list so you know who was there that night. So that's really what we want to do here. We're asking first about information about you, the person who is submitting this form. So if we have any questions back about this is the person that we will be contacting to answer these questions. So your name, your title, email, phone, which program this is. And again, we ask for this if you have multiple programs that you're reporting for, please complete one of these for each of these programs. What this form does on the back end is it spits it all out into a very nice Excel spreadsheet for us. So if you were submitting multiple programs in one of these lines, it doesn't add up very well. So your agency and your program name, what type of project you are. Again, most of you are going to be DV, but some of you don't have another system to use, or you're kind of in the process of doing a transition at the moment. And then some information about the actual program, like are you solely dedicated to serving veterans or youth? or you kind of don't have any restrictions and you kind of serve anybody who comes right on into the system. And then you'll go to the next section down here. And so this is, again, the actual numbers that night. So how many total persons did you have? And then if you can, break them down by age here, under 18, 18 and 24, and then anybody 25 and older. This is a requirement not only for us when we have to report out, we have to pull out these ages and report them that way. But as some of you may know, the City of Boston won a youth homeless demonstration program grant in the past year, which is going to allow us to put some energy and focus behind our increasing homeless youth population. So this information will help us. If you are a family provider, we are then asking you to kind of break out by households or families, and then how many people. So how many households did you have there that night? Did you have 10 households with maybe 12 adults and 35 children? I'm throwing numbers out here, but that's how you want to look at this thing. We really want to be able to slice it out that way. And then again, we're looking at by ages so that we can report out both on the adult males. And again, this kind of is regardless of if they're the head of household or if they even are a child. We're really truly going by ages in this section. Unaccompanied youth, again, is anybody who is 24 or younger without a parent or without a child as well. They truly are somebody. I'm a 22-year-old and I'm coming all by myself. I don't have anybody with me. So again, we're breaking them down by 24, 18 to 24, and under 18. These parenting households, sorry about that. That would be, the other would be, I'm a 22-year-old mom and I have a 4-year-old child with me. That family we would want them to be pulled out here as part of the parenting households. And what I also want to mention is that these should be kind of pulled out from your overall numbers, right? Your overall numbers up here are truly everybody put together. That's everybody. And then when we get down here, these are all subsets of those total numbers that you gave us up above. So sorry, I'm scrolling through this. Total juvenile parents, if they were 24 or younger, juvenile parents at 18 to 24, and then if you had any juvenile parents, maybe you have a 17-year-old who has an infant with them, they would be counted in this situation. And then we would ask you to add up all of the children who are with these parents here. And then veterans, if you do have any veterans in your program, they do not have to be VA eligible veterans. The answer to the question is, have you ever served an active duty in the military? That is all. You raised your right hand and you have served, so you therefore are a veteran. If you have any questions about this form, please, again, contact myself, Jennifer Flynn, or right here, or Kadra Adderley. We can help you complete any of this information. But again, this is just overall numbers about your program. We are asking that this form be completed by Friday, February 1st, for those who are in your program on Wednesday, January 30th. We understand that this is a quick turnaround time. If by some chance you cannot make that deadline, please just email us and let us know, and then we can go from there. We would much rather have an email from you saying that you won't get it to us until Monday or Tuesday than us having to chase you down for it. So after you've completed kind of your quick count of who was there, then we ask you to actually get into some more in-depth information about the clients. This is so that we can do a little more reporting on ages and genders, ethnicity, race, some disability information, and some other kind of maybe where they were coming from for policy and planning purposes. Some of these questions, again, are required for us to report back to the federal government, and others are required HMIS data collection elements, but we use internally sometimes at the city to kind of make some more policy or planning decisions. Again, because you guys are not using HMIS, this is a completely de-identified Data collection point, we are not asking for any client information. We are not asking for anything that could possibly tie this back to a client. But we are asking for each client to have one of these completed so that we can fill out, we can complete the aggregate information with the HMIS data that comes into the system. So again, email address, name, last name, and title of the person who is completing these forms for us, not the client. This is your information. If we have a question about this, this is who we're going to come into. And again, the agency and the program. Then next, you'll continue on to the client questionnaire section. We do have documents that that will be available to you if you need to use them as intake forms. So when did the client start your program? Again, when they came in, it is simple as that. It's not going to be yesterday. It could be a very long time ago. Household ID, all we are asking is that you are able to say that the household that you numbered number 1 is Jennifer Flynn's household back at your shelter. You yourself at your agency need to have some kind of way to figure that out, but we do not want your household IDs. We do not want your actual case numbers. We want you to kind of figure out some kind of way to mask that. But make sure that mom and 3 kids all keep the same household ID so that we can group them together as a family afterwards. Same with client ID. It can be 1, 2, 3, 4, 5. Just make sure that back at your agency, you know that the client you said was 1, 2, 3, 4, 5 is Jennifer Flynn. And again, kind of where in the household makeup are they? Are they a single person, or are they, the head of household or a child? Age, gender. Again, this is all client self-reported information as well. So that is the information that you use. Ethnicity and race always tend to be a little bit of a sticky situation, in particular with Hispanic Latinas. And it truly is a 2-part question. So Hispanic Latino also must identify, we're looking for them to identify a race on top of that. But as you see, client refused and client does not know are optional answers. We would much prefer that you fill that out instead of leaving this as a blank, which it won't let you anyway because we're requiring it. So this is the veterans question. Have you ever served in active duty in the armed forces? And so this information here, your last permanent address, city, state, and zip code, this is what I was talking about earlier as we began, that the city is now requiring to collect some of this information before. Again, it is not an eligibility criteria. It is truly just for information purposes. Where did you stay last night? Is looking for what type of a program was the client in before they entered your program. For clients that have been in your program for a long time, it was where they were that night. We do tend to see lots of emergency shelter, and lots of family and friends typically end up being this answer. And then how long were you there? Was that a quick situation, or were you actually stably housed for a really long time and then you lost it? The next information is the data that is used to get at how long and how many episodes a client has had in order to try and determine if the client could be possibly chronically homeless or not. So what's the approximate date that they became homeless? How many times in the last 3 years have they been in the streets or in the shelter? Approximately how many months? And have they been continuously homeless for a year or longer? How many times have they been homeless in the past 3 years? So the chronically homeless definition itself is that the client must have a disabling condition. It was an 18-year-old, had a household that has a disabling condition, first off, and then must have been either continuously homeless for 1 year or longer, or has had 4 episodes of homelessness in the last 3 years that total 1 whole year of homelessness. So as you can see, those questions there, as difficult as they may be, are really trying to get at if that client fits that information. And then we're looking at some income and benefit sources as well. So if the client does have some income, you can check off these boxes. They should be fairly similar to what you've seen before. And then what is the total monthly income from all sources? Again, it should be their regular monthly income, if they get, whether it be child support or work, or whatnot. And then if they have any of the following benefits as well. And type of health insurance. And now we get into some of the disability information that they have. Again, this is all client self-reported information. This is not documented HIPAA information. And the client has the ability to refuse. But again, for both policy and planning purposes, but also on a more client case manager level, you want to get as much information as possible with this client so that you can help them move them out of homelessness and stabilize their housing crisis and get them the accurate supports that they need. So you really want to be intentional about trying to collect some of this information just for your own case management purposes. Right? Do they have a chronic health condition, HIV, AIDS, mental health condition, substance abuse problem? And are they currently fleeing from domestic violence? And then if this is a female, are you pregnant? And when is your due date? Oh, those old community of origin questions that you went through have to be deleted, apparently. These are the new questions that you will see. So again, the client questions, we understand that these are going to take a little bit more time to go through because some programs may have many of these to complete. So we are asking for these to be completed by I believe it's the 15th. And again, if you're unable to complete these at that time, please just reach out to us and let us know. We would much rather have a kind of a running list of those that are still working on things than the running list of folks that we need to start reaching out to. So again, if you have any questions, please contact myself or Kadra Adderley, and good luck with your account.